We are trying to change the way we practice medicine. We should be demanding change and driving change.
We've talked for decades about we need to have patient-centered healthcare, but we really haven't had the systems in place that enable us to do that.
So we have to take the best of what Silicon Valley has, where you can be nimble and quick.
Salesforce is helping us look at the world differently. They're helping us, push our edges in terms of what should a connected world look like? What would it look like if healthcare communications was social, if it was mobile, and if it was built around the patient?
We need new tools and new tactics for busy clinicians to connect both with each other and with other healthcare providers and with the patients and their families.
So by leveraging the Salesforce One platform, we can develop mobile apps much more rapidly. We're probably the only industry that remains that uses pagers, and that's an incredibly inefficient way to communicate. One of the applications that we've built is what we call the CareWeb communications platform. CareWeb allows us to have conversations. They're threaded conversations so everyone can see what's going on, and the patient will actually be engaged in the conversation, be able to see what the providers are saying.
They have continuous connectivity to their providers to be able to partner with them on the most important decisions of their life.
We're starting to scratch the surface and see the multifaceted ways that the platform can help us out. So gamification's a great example, and some of our ICU folks built a really cool application that's had a lot of success engaging providers to really adhere to these best practice protocols that were challenging to adhere to. Now others are following with other similar applications. Yet nurses are walking around, they're delivering educational content. We have the patients doing surveys right on iPads, other tablets while they're in the hospital.
And if they're facing either a disease or the threat of a disease, they can get involved and understand what's happening and connect with their community and their clinicians in different ways.
So every woman who comes in for mammographic screening is sent a questionnaire, which they can fill out on an iPad. As soon as they fill that out, Salesforce calculates their risk for getting breast cancer. We can send that risk report back to the patient and the physician. And then all that information comes together and filters through the system in the way it can be used by everybody and create a learning system that accelerates our knowledge.
What is fantastic about health and medicine today is the change is coming quickly, the pace of change is increasing.
We're capturing data from places we never imagined.
There's a whole, wealth of connected devices right now that connect the patient to the cloud.
But what's really meaningful is that my clinician has access to that data in real time.
We need to use the power of a platform like Salesforce to be able to computationally raise the level of that data to information. You start to contextualize that, and all of a sudden you start to get a picture of what's going on and call that patient and say, you know what, even before you know it, we know that something's going on. We want to see you in the hospital immediately.
When you can start from the platform that gives you all the tools, gives you the scalability, gives you the robustness, gives you the privacy and security already built in, we don't have to worry about those parts anymore. Now we can just build on the healthcare specific parts that are our strength.
It frees them to use that brain power and their precious resource, which is time, on the hardest things that we still are trying to figure out, which is what's the best thing for this person who's sitting across from me.
Most people went into medicine to make a difference and to have relationships with patients.
We need to be thinking about our patients more as customers. They are consumers, and they need to be treated much better than we used to treat them when we thought of them as patients.
Because of the collaboration between UCSF and Salesforce, I can now connect with many more patients in many new ways, and to me, that's thrilling.